barriers. So what are some of the misconceptions and misunderstandings that really bother you the most about working with circus artists? And then how would you maybe address those?
Yeah. The smallest and simplest one is that I'm not seeing circus artists, right? That's actually like, as small as that is, it's like, oh, once you start making that assumption, you've now closed the door to that conversation for that artist. That artist doesn't feel like they can necessarily bring it up. So that's one. Two is that I'm not capable of seeing circus artists. Oh, yes, you are. They are the same in some ways as our other orthopedic patients. And by understanding how the body works, you have the skills to view, to analyze and assess their movement. So you can do it. It's always helpful to have tools, but getting them in the door and making them feel comfortable is the biggest tool you've got. Always listening to our patients and hearing their stories. Range of motion and what's normal and what they should be doing with their bodies. Yes, there are some things that we do want to help them understand the stresses they're putting on their bodies, but what they should be doing with their bodies is moving them throughout their lifespan. If we can do anything to help keep people moving, active, and happy about their movement, that's our job. So when people tell these artists to stop doing that, whatever that is, or to stop training altogether, that's my biggest pet peeve. Pet peeve? Peeve. Let's go peeve. Full on peeve. That is my biggest concern, is that we're telling folks that are happy about movement, often in their adult years, which is really rare, or in our population, to have adults who are excited about learning movement, and we should be doing everything we can to keep them doing it. On that note, if you don't know much about circus, one of the most important things I can give you as a tool to take away is that circus is modifiable. You almost never need to tell someone to stop doing circus. What you need to do is talk to them and collaborate with them, or if you have the time, and I know we're all really busy professionals, talking to their instructor or their coach about the actual specific things that are concerning you about what they're doing and how they can avoid them. Circus is so cool in that there are so many different ways to change it. Okay, you don't want them hanging from straight arms because whatever reason, doesn't matter. You don't want them hanging from straight arms. What can they do sitting in a different apparatus or the same apparatus and doing everything with bent arms? They have a broken ankle. Great. How do you keep them training even through that in a safe way? If they're a high-level artist, they may not be at risk of falling down any more than they would be walking across the street in a boot. How do we keep them balanced in training, getting creative, really thinking about it? But the biggest thing is keep them training, keep them moving. We want to encourage that movement. We want to encourage a love of movement and a love of activity. And this is a great way for folks to do it. I'm going to take a little detour and a quick story if I can, Jimmy. Are we good? I had a patient of mine that came in and sought me out because she is a 72-year-old pole dancer, and she injured her shoulder golfing. And she went to her doctor and said, "I'm pretty good, but I still have shoulder pain when I do pole." And he said, "Well, you should really stop doing pole. It's dangerous. Just stick to golfing." It's like, yes, but she got injured golfing. And we have a 72-year-old who wants to play with her vestibular system. They have somebody who is playing with their proprioceptive abilities, who's still doing strength training, and is working on range of motion. What else do we want for our older adults than to do those things? So really thinking about the words that are coming out of our mouths as we work with these folks to keep them moving and keeping them active.